kind of schedule to talk about Syneron, give you an introduction about Syneron and about what happened in the last few months with Syneron in the market. I want to start just giving you a brief details of what Syneron is. The history was founded in 2000, and then we started doing the first sales in 2002. We went public in 2004. Last year, our revenue for the company was $180 million US. That is a combined revenue between Candela and Syneron. We are very well known in the market about ELOS technology. We were the first one to introduce this technology in 2002, and we are very well known in the market about that, especially in Asia, where it's very successful. We have 8 patents granted and over 20 pending to get granted. We got the largest portfolio of equipment in the market today.
Hi everyone. For me, it's a wonderful thing to be back here. For those I don't know, I think there are a lot. And we'll talk about a couple different systems and so forth, and we'll treat. I like coming here and telling you something new. So we'll end with the new. So I'll start with what's out there. This EMAX technology. Again, people know me. I work with lots of laser companies, and for this I'm sponsored by Syneron. But I do spend a lot of time in China. I like China too. So we know what the market strength is in aesthetic medicine. I don't have to tell anybody. When you look at the Philippine market, and all you have to do is pick up the newspaper here. You all advertise more than anybody I've ever seen, and do it quite well. But we know that you're doing it because the aesthetic market is still growing, and it's still growing. And the U.S. had a little difficulty with our recession in 2009, and it's still going on a little bit in 2010. But we've all seen an increase in our procedures. But what really hasn't gone away in all of this is the non-invasive cosmetic procedures that we've done. And the docs out there like to talk about their breast implants and breast reductions and all these other invasive procedures. But the non-invasive market, as it says here, for the past 10 years, has increased, this remarkable pace. And so there's really there's stopping this as far as we can tell at this point. And it should only get better. I was talking to the press earlier, and one of the things I said to them, for those of us that have been in the laser business for a while, we went through a pretty stagnant time where there was nothing new. In the last 3 or 4 years, even during our recession, the market has grown as far as the number of different devices, the technology is getting better, and so that's good for all of us. These companies, as Miguel said, this company will spend $20 million US dollars on research. That's very important to us because we need new products, we need new ideas to keep ourselves fresh and to keep ourselves excited about this business as a whole. And so again, we know what the demand is, and the demand was fueled by Botox. So we can't kid ourselves. Allergan did us all a very big favor by coming out with Botox, and that sort of fueled this non-invasive cosmetic surgery that we all do. And we know that the non-surgical procedures, these are the surgical procedures, should say, they're good, but the other things that we do are growing, at an even greater rate. And when you look at the different technologies out there, you sort of have to say, okay, what do I have? How old is that? And what are the new things that will sort of replace that technology? And what am I missing? And you basically figure that out by looking at your patient population and what works best with your patient. And these are the non-surgical procedures. Sorry, I mischarted that. But Botox obviously is the behemoth of what we do in things. And according in 2009, if you look at the chemical peels have gone 5, and laser skin resurfacing is up to 4. Laser skin resurfacing has had a big surge because of the fractionated treatments. And I don't know about the Philippines, but 3 or 4 years ago, my patients came to the office and said, "I want Fraxel." And my patients don't say that anymore. My patients actually now come in and they go, "I want a fractional laser treatment." So I've watched the change, and again, I have nothing against Fraxel. They set the bar high as far as the marketing and advertising and getting patient awareness. But now my patients or the media or whoever has gotten us, the patients a little more savvy, and we talk about, they come in and ask for fractional resurfacing and what's available in that. So we have a lot of different systems, and Syneron makes a lot of different machines, and their technologies have changed dramatically since the early days of Syneron, and that's good. And we're going to talk about the EMAX and the E-Matrix, and I think they have them all out there. And then when we're finished, we'll actually treat somebody with the E-Matrix, which is really cool. But you might have heard of some of these names of some of the devices. You may have some of these devices. I'm sure that Durant and Cheryl and the rest of them would like to upgrade you to some of the newer ones. But these are the old devices, and it was sort of looked at by Syneron. We had lasers and we had IPLs, and you have to understand who Syneron is. Syneron is a huge company with one man behind the company who sort of invented the concept of IPL, and then sort of from there took all this other laser physics and energy-based knowledge that he had and created this ELOS technology, or added radio frequency, to, in essence, make the procedure safer. And that's one of the keys of combining the radio frequency, to me, into the devices that we have. And this is a different kind of radio frequency. I actually turned on CNN last night, and they had an hour of Larry King dealing with cell phones and how bad cell phones are, giving out radio frequency waves because they're going to cause cancer, and everybody that uses cell phones are going to develop brain cancer, which is kind of ridiculous to my thinking. But this is a different kind of radio frequency than that, and we're going to talk about bipolar radio frequency, which is different, and we're not going to spend a lot of time differentiating it from monopolar radio frequency or unipolar radio frequency, and now there's tripolar radio frequency, and soon there'll be 4 poles and 5 poles. But bipolar radio frequency has been around now for about 6-7 years, so it's stood the test of time, and that's helpful. It's safe, it's effective, it heats the target. Heating the target, again, allowing us for certain applications to use less laser energy, or heating the target sufficiently enough and deep enough to actually provide dermal remodeling. And a lot of us, when bipolar radio frequency first came out, compared to monopolar radio frequency, didn't think it really worked because it wasn't going deep enough. But the new devices will allow us to penetrate the bipolar radio frequency as deep as we really need to, so we can control the penetration depth. And what's nice for this region is that radio frequency is colorblind, and that's really important. So you can treat on all skin types, which brings me to something I've said every night on this trip that I've been on. Somebody needs to write redo the Fitzpatrick skin types and have skin types for Caucasians, skin types for Hispanic skin, skin types for Asian skin, and skin types for black skin. Because you guys have 20 different variations of your skin types, depending on where you're from in Asia, or really probably where you are in the Philippines even. That it's not all the same. And to say, as my teachers taught me, Asian skin is type 4. That's ridiculous. I mean, but that's how we're taught, and that's how we talk. That's why we talk about, well, does this machine cause post-inflammatory hyperpigmentation and so forth and so on? Because we don't always, at the beginning, we didn't always think of these the way we should have. And it's to your all's credit, that now at least we think about it.